for the abdomen assessment, we're just going to start by introducing ourselves to the patient, letting them know what we're going to do today, and then we're going to help them to a supine position so that we could get started with the assessment. Abdomen assessment would be inspection, auscultation, percussion, and then light and deep palpation. So for the inspection part, we're just looking at the patient's stomach, and we're looking at like the color, the contour, and like the stomach should be flat or rounded, like a shape, flat or rounded. And then we're looking for any lesions or scars, and then a hernia. And to test that, we would just have the patient lift up their head, and then we would be looking at the stomach for any hernias. And hernias, like, they arise from a superficial bleeding within the skin under the stomach. So we're just inspecting the stomach, and then we would move on to auscultation of the stomach. So for auscultation of the stomach or the abdomen, we would start in the ileocecal valve, because this is where bowel sounds are usually present. And so we would start there. And then we would go to all 4 quadrants, just listening for the bowel sounds. And we're listening 3 to 5 minutes if we don't hear anything before we document that there's no bowel sounds. And for each bowel sound, it should be in a regular pattern, and it should be 5 to 34 clicks during, like, while you're listening. And then we're gonna auscultate the aorta, the renal, the iliac, and the femoral arteries. And for that, we're listening if there's a bruit heard, which there shouldn't be. So we would start at the aorta, and then the renal, and then the iliac, and then the femoral. While we're auscultating that, we're just listening if there's any bruits heard. So then the next step is percussion of the abdomen. So you would use an indirect percussion, and then you're just going over all 4 of the quadrants. And what should be heard is a timpani sound over the quadrants, and then a dullness sound or over the organs. And if it's like a hypertimpani, that could be like they have undigested food, or there's maybe fluid. So we're just listening for the dullness and timpani during the percussion. And then the next step is palpating the abdomen. And when we're palpating the abdomen, we're using 2 steps, which is light palpation and then deep palpation. And light palpation is you're going about 1/2 inch into the patient's stomach, and you're looking for like tenderness, and you're watching the patient's face to see if they're showing any pain. So you want to do that in all 4 quadrants too, and that's just a light palpation. And then the deep palpation assesses for enlarged organs or masses and tenderness. So that's about 1.5 inches to 2 inches you're going in. So you're doing the deep palpation, and there should be no tenderness or masses felt for that. So for the abdomen assessment, you could also include the palpation of the bladder, and you would start at the symphysis pubis or the umbilicus. And then you should know, like, the normal findings are that a empty bladder is non-palpable, and a partially filled bladder is firm and smooth, and then a distended bladder is palpated as a smooth, firm mass, and it is enlarged all the way to the umbilicus. So that's the abnormal findings that we're looking for, but it should be an empty bladder, which is non-palpable. So during the assessment of the abdomen, you're going to do some tests and look for some signs. So one of the tests is the Fosis sign, which you're going to have the patient lay on their left side, and then you're going to hyperextend. Yeah, I think it's hyper. You're going to hyperextend their right leg, and then no pain should be felt. If there is pain felt, that could be an inflamed appendix. And then another test is the obtruder text. And then another test done is the obtruder test, which is we just have them back into the supine position. And what we're going to do is flex the hip and no pain should be felt for that. If there is, that's another like sign of an inflamed appendix. And then another test done is the Murphy sign, which we are just going to palpate at the liver, like border at the right costal margin. And we're going to have the patient take a breath in and out. And if there's any pain for that, that would be an inflamed gallbladder. So after all of the tests and like assessment is done for the patient, you would just document your findings.